Welcome to the Deep Dive, your shortcut to being well-informed. Today, we're tackling something that, well, trips up a lot of people: Medicare enrollment.
Uh-huh.
It's obviously this critical benefit, but honestly, navigating the rules, the deadlines, all those letters A, B, C, D, it can feel like a real maze.
It really can.
So our mission today is simple. We're diving into your sources on Medicare to pull out the absolute must-know information. Getting this right affects your costs, your coverage, and getting it wrong, well, that can mean penalties that stick with you for years.
Exactly. And that's why this is so vital. We're talking about decisions that impact your health, your wallet, how you manage existing insurance. It's about empowering you to make choices that fit your specific needs quickly, but, thoroughly, without drowning in jargon.
Okay, perfect. Let's unpack this then. When we talk Medicare, it's basically built on 4 parts, right? Sort of like 4 pillars holding everything up. What are these core pieces we need to get our heads around first?
Absolutely. Understanding these 4 parts is, well, it's fundamental before you can make any smart choices later. First up is Part A. That's your hospital insurance.
Oh, okay. Hospital.
Right. It covers things like inpatient hospital stays, skilled nursing facility care, hospice, even some home health. Then you've got Part B. That's your medical insurance.
So doctors and outpatient stuff?
Precisely. Doctor visits, outpatient care, preventive services, some medical equipment, that sort of thing.
And then there are the parts that seem to involve private insurance more, C and D.
That's right. Part C is what's called Medicare Advantage. These are plans from private companies, approved by Medicare, of course. They bundle Part A and Part B, often include Part D drug coverage, and frequently add extra benefits, think dental, vision, that kind of thing.
Okay.
And then there's Part D itself, which is specifically your prescription drug coverage. It helps cover the cost of your medications. What's really key here, and maybe a little fascinating, is how these parts all interact. They're not separate islands. You have to see them as pieces of a puzzle to avoid, frankly, some expensive mistakes.
Right. So let's start with Part A. You hear it's often automatic or free. How does that work?
Yeah, for a lot of folks turning 65, if you're already getting Social Security or railroad retirement benefits, you often just get enrolled in Part A automatically. And the premium-free part, that's because most people, or their spouses, have paid Medicare taxes while working for at least 40 quarters. That's about 10 years.
Okay.
So the general thinking is, hey, it's premium-free, it covers major hospital costs. It's almost always a good idea to take it as soon as you're eligible, even if you have other insurance. It's a good safety net.
Makes total sense. Is there ever a situation where someone wouldn't want to take that free Part A right away? Seems like a slam dunk.
There is one main exception, and it catches people by surprise sometimes. It's if you are still actively contributing to a health savings account, an HSA. The moment you enroll in any part of Medicare, even premium-free Part A, you can no longer make contributions to your HSA. So if maximizing those HSA contributions is a big goal for you while you're still working, that's the one common reason to potentially delay Part A.
Got it. That's a really specific but important point.
Otherwise, yeah, it's usually a no-brainer.
Okay, so Part A, often straightforward. But Part B, this feels like where the real complexity kicks in, and those penalties people worry about. What's the absolute crucial info on Part B?
You're right to flag that. Part B is essential. It's your coverage for outpatient medical services. Think doctor appointments, preventive screenings, lab work, physical therapy, medical equipment like wheelchairs or walkers. It's your day-to-day medical coverage, really.
And it definitely has costs, unlike Part A for most people.
Well, yes. There's a standard monthly premium. I guess around $174 for 2025, but that can change. Plus, if you have higher income, you'll pay more because of something called IRMAA surcharge.
The IRMAA.
Then there's an annual deductible you have to meet, and after that, you typically pay 20% co-insurance for most services.
So definitely costs involved. And the timing of enrollment for Part B seems absolutely critical. What are those key windows?
The enrollment periods for Part B, yes, absolutely critical. Number 1 is your initial enrollment period, the IEP. That's a 7-month window centered around your 65th birthday.
7 months. Okay.
Right, 3 months before the month you turn 65, the month you turn 65, and the 3 months right after. That's your main window.
What if you're still working, have insurance through your job?
Good question. That's where the special enrollment period, or SEP, comes in. If you have qualifying health coverage through a current employer, yours or your spouse's, you can delay enrolling in Part B without penalty. The SEP lets you sign up later, usually within 8 months of losing that coverage or stopping work.
That SP sounds like a lifesaver for people working past 65. But what if someone misses both the IEP and doesn't qualify for a SEP? Are they just out of luck?
There is another chance.
Okay.
But it's not ideal. It's called the General Enrollment Period, or GEP. This runs every year from January 1st through March 31st.
Okay, so there is a window.
There is, but here are the big catches.
Yeah.
If you enroll during the GEP, your coverage doesn't actually start until July 1st of that year. And crucially, this is where those late enrollment penalties almost always kick in.
And this penalty, this isn't just a one-time slap on the wrist, is it? I hear it's permanent.
That's the really tough part. It is permanent. If you delay Part B enrollment and you didn't have that qualifying employer coverage, you face a penalty. It's 10% of the standard Part B premium added on for every full 12-month period you could have had Part B but didn't sign up.
Wow. 10% per year of delay. Forever.
Forever. It gets added to your monthly premium for as long as you have Part B. So a delay of, say, 2 years means a permanent 20% increase in your premium. It's a mistake that literally costs you money every single month for the rest of your life.
That is incredibly significant. So let's nail this down. The only way to safely delay Part B past 65 without that penalty is if you or your spouse are actively working and covered by a group health plan from an employer with 20 or more employees. Is that right?
That's the primary way, yes. Active employment, group health plan, 20-plus employees. And here's the landmine so many people step on. COBRA coverage does not count. Neither does retiree health coverage.
Wait, seriously, COBRA doesn't count.
Seriously. It's probably one of the most common and costly misunderstandings out there. People think, I have COBRA, I'm covered. But for delaying Part B enrollment penalty-free, nope. Doesn't qualify. You must enroll in Part B during your IEP if you only have COBRA when you turn 65.
Wow. Okay, that point alone is worth the price of admission. I can absolutely see how someone gets tripped up there. That's a huge takeaway.
It really is.
So, okay, you navigate A, you carefully manage B. Now you have this big decision point, what you call the Medicare crossroads. Original Medicare versus Medicare Advantage. Let's break that down. What's the first path, original Medicare?
Right. So the original Medicare path is where you enroll in Part A and Part B directly through the government. That's your foundation.
Yeah.
Then to round out your coverage, you typically need to add 2 more pieces.
Okay.
Usually a standalone Part D plan for your prescription drugs. And very often, people also buy a Medigap policy, also called Medicare Supplement Insurance.
Medigap. That helps with the out-of-pocket costs.
Exactly. Medigap plans are sold by private companies, and they help pay for things original Medicare doesn't fully cover, like your deductibles, your coinsurance, that 20% we mentioned for Part B, for instance.
Okay, so that's original Medicare plus Part D plus maybe Medigap. What's the alternative? Medicare Advantage Part C.
Right. Medicare Advantage Part C is the other main route. These plans are offered by private insurance companies that have contracts with Medicare. They have to provide at least everything original Medicare Part A and B covers, but they bundle it all together.
Bundled. Okay.
Yeah. And they often include Part D prescription drug coverage right in the same plan. Plus, they frequently offer extra benefits you don't get with original Medicare, things like routine dental care, eye exams, hearing aids, maybe even gym memberships.
Those extra benefits sound pretty appealing, definitely. But I always hear about networks with Medicare Advantage. Is that limitation a big deal?
It can be, yeah. That's one of the main trade-offs.
Yeah.
Let's look at the pros and cons.
Okay.
Pros for Advantage. It's often an all-in-one plan, which can feel simpler. Monthly premiums might be lower than the combined cost of original Medicare plus Part D plus Medigap, and you get those extra benefits.
Sounds good so far. What are the downsides?
Cons. Most Advantage plans use provider networks, like an HMO or a PPO. That means you might be restricted to certain doctors and hospitals. If you go out of network, it could cost a lot more or not be covered at all, except in emergencies.
Right, so checking if your doctors are in network is huge.
Absolutely critical. Also, your out-of-pocket costs, like copays and deductibles, can vary a lot between plans and when you use services. And a really important point, you cannot use a Medigap policy with a Medicare Advantage plan. They don't work together.
Okay, that's key. No Medigap with Advantage. So deciding means really thinking about your specific doctors, how much you travel, maybe how predictable you want your costs to be.
Exactly. You need to check the network, understand the plan's maximum out-of-pocket limit for the year, look closely at the drug formulary if it includes Part D, and definitely consider if you need coverage flexibility, say, if you travel or live in different places part of the year.
And the timing for choosing Part C. Similar windows.
Pretty similar initially. You can often join an Advantage plan during your IEP when you first get Medicare, but the really big period is the annual enrollment period, or AEP. That's October 15th to December 7th each year.
That's the time to switch things up.
Yes. That's your main chance each year to join a Medicare Advantage plan, switch between Advantage plans, or drop one and go back to original Medicare. There's also another window, the Medicare Advantage open enrollment, from January 1st to March 31st. If you're already in an Advantage plan, this lets you switch to a different Advantage plan or go back to original Medicare.
Okay, lots of dates to keep track of there. Now, let's zero in on Part D, the prescription drug coverage. Medications are such a huge expense for so many people. What are the basics here?
Right, Part D plans are offered by private insurance companies, and they exist solely to help you cover the cost of your prescription drugs. The absolute key thing to know is that each plan has its own formulary.
Formulary. That's the list of drugs they've
Exactly. And these formularies can vary wildly between plans. So job number one is making sure the specific medications you take are on the plan's list and how much they'll cost you.
And the costs for Part D involve premiums too.
Yes. You'll typically pay a monthly premium, which varies by plan. Again, higher income folks might pay an IRMAA surcharge on top of that. There might be an annual deductible. And then you'll have co-payments or co-insurance when you fill prescriptions.
And these plans have those coverage phases, like the donut hole. Sounds kind of ominous.
Yeah, the donut hole, or the coverage gap as it's officially called.
Yeah.
Well, it's a phase in the plan. Basically, after you and your plan have spent a certain amount on drugs during the year, you hit this gap where you temporarily have to pay a higher percentage of your drug costs.
So you pay more for a while.
You do, until your total out-of-pocket spending reaches another threshold, which puts you into the catastrophic coverage phase. Once you're there, your drug costs drop significantly for the rest of the year. It's less of a hole than it used to be thanks to legislative changes, but it's still a feature of the plans.
Okay, that clarifies it a bit. Not a total gap, but a period of higher cost sharing. And just like Part B, there's a penalty warning with Part D too, right?
Oh, absolutely. Another critical warning here. If you go without creditable prescription drug coverage for 63 days or more after your initial enrollment period ends, you could face a permanent penalty if you decide to enroll in a Part D plan later.
Permanent again. How does this one work?
This penalty is calculated as 1% of the national base beneficiary premium. That's a figure set each year multiplied by the number of full months you didn't have Part D or credible coverage. And just like the Part B penalty, it gets added to your monthly Part D premium for as long as you have coverage.
Wow. So missing the boat on B or D can cost you extra every month, indefinitely.
Precisely. Which is why understanding your enrollment periods is so crucial. For Part D, it's your IEP, and then that annual enrollment period from October 15th to December 7th each year is your main time to join, switch, or drop a plan.
Okay, so pulling this all together, what does this mean for you listening right now? It means you really have to coordinate how you approach these parts. It's not just picking one thing in isolation. Let's talk about avoiding the big mistakes.
Yes, let's shift to practical advice. How do you avoid these costly pitfalls?
What are the absolute must-dos?
Okay, number one. I know we've said it, but it bears repeating. Don't miss your initial enrollment window. Seriously, this is ground zero for avoiding those permanent late penalties for Part B and Part D. Get those dates on your calendar.
Right, calendar it. What's next?
Number two, if you are delaying Part B or Part D because you have other coverage, confirm that coverage is creditable according to Medicare standards. Don't just assume. And crucially, get written proof from your employer or insurance plan.
Written proof. Don't just take someone's word for it.
Exactly. That piece of paper can save you a massive headache and potentially thousands of dollars down the road if Medicare ever questions why you delayed.
Smart. What else?
Third, review your plans every single year during that annual enrollment period, October 15 to December 7. Drug formularies change, doctor networks change, your own health needs change. What was perfect last year might be a bad fit this year. Don't just let it auto-renew without checking.
Good habit to get into.
Fourth, think about travel. If you spend winters elsewhere or travel a lot, Original Medicare generally offers coverage nationwide. Many Medicare Advantage plans have regional networks and might only cover emergencies outside their service area. That's a huge lifestyle factor.
Yeah, that could be a deal breaker for some.
And finally, number 5, look beyond just the monthly premium. The plan with the lowest premium might end up costing you more overall if it has high deductibles, copays, or doesn't cover your specific drugs or doctors well. Consider your total potential costs based on your health.
That's great advice. Consider your total picture. And quickly, you mentioned special enrollment periods before for Part B. Do those apply in other situations too?
Yes, besides leaving employer coverage, there are other special enrollment situations. Things like moving out of your planned service area, losing coverage from Medicaid, qualifying for extra help assistance with Part D costs, or even having certain chronic health conditions can trigger an ASEP, giving you a chance to change plans outside the usual windows.
Good to know there are other opportunities if life changes things up. So if someone's trying to decide right now, maybe during their IEP, what's a good framework?
Okay, a practical approach. First, make a list. List your doctors, specialists, hospitals you prefer. List all your prescription medications, dosages too. You need this info to check networks and formularies.
List everything.
Got it. Second, do the math, or at least estimate. Look at the monthly premiums, yes, but also the deductibles, typical copays for services you use, and crucially, the plan's maximum annual out-of-pocket cost. What's your worst-case scenario cost?
Okay, estimate total costs.
Third, weigh flexibility versus predictability. Do you value the potential lower monthly costs and extra perks of an Advantage plan, even with network limits? Or do you prefer the predictability of costs with original Medicare plus a Medigap and the freedom to see any doctor who accepts Medicare nationwide?
Flexibility versus predictability. That's a good way to frame it.
And fourth, maybe most importantly, think long-term. Try to choose coverage that anticipates your needs not just for next year, but potentially as your health evolves.
Yeah.
Switching later, especially getting a Medigap plan, can sometimes be harder.
That makes a lot of sense. Okay, let's make this even more concrete with a few quick scenarios. How would this apply?
Sure. Scenario 1, you're turning 65, retiring, and have no other health coverage. Pretty common.
What do you do?
You need to enroll in Part A and Part B during your 7-month initial enrollment period. No question, to avoid penalties. Then, you make that big choice. Either go the original Medicare route and also pick a Part D plan and likely a Medigap policy, or choose a Medicare Advantage Part C plan, which might already include drug coverage.
Straightforward. Okay, different situation. Scenario 2. You're working past 65, maybe you're 67, and you have good health insurance through your job.
Right. In this case, if Part A is premium-free for you, which it usually is, go ahead and enroll in just Part A. Just A, usually. You can likely delay enrolling in Part B and also Part D as long as that employer coverage is considered creditable by Medicare. When you eventually stop working or lose that coverage, you'll use your special enrollment period to sign up for Part B and Part D without penalty.
Makes sense, using that sub-P. Now, the tricky one we highlighted. Scenario 3. You're turning 65, maybe you lost your job recently, and you're currently on COBRA.
Ah, yes, the COBRA trap. This is absolutely critical.
What's the play?
You must sign up for Part B during your initial enrollment period around your 65th birthday. COBRA does not count as creditable coverage for delaying Part B. If you rely only on COBRA and miss your IEP for Part B, you will face that permanent late enrollment penalty when you eventually do sign up.
So even though you have COBRA, Medicare essentially sees you as uncovered for the purposes of that Part B deadline.
Exactly right. A very easy and very expensive mistake to make.
Okay, that really drives home how vital understanding these specific rules is. Let's try to quickly recap the absolute headline points from this deep dive.
Sounds good.
So Part A, usually premium-free, generally wise to enroll at 65 unless that HSA contribution issue is a factor for you.
Right.
Part B covers your outpatient care, doctor visits. Crucial not to delay enrollment past your initial window unless you have that specific, active, creditable employer coverage. And watch out for COBRA.
Definitely.
Part C, Medicare Advantage. The private plan alternative bundles services, often includes Part D and extras, but usually comes with networks. And Part D, prescription drug coverage. Essential to get creditable coverage when you're first eligible to avoid that permanent penalty. Review plans annually.
Perfect summary. And that really leads us to a final thought for you to consider.
Okay.
Making your Medicare choices.
Okay.
It isn't really a one-and-done decision you make at 65 and then just forget about.
Yeah.
It's much more of an ongoing process. It's about continually aligning your coverage with how your life changes, your health needs evolve, your financial situation might shift, maybe your travel plans change.
Thinking of it as dynamic, not static.
Exactly. So the thought to leave you with is, how might your personal big picture change over the next few years? And recognizing that really underscores why it's so important to proactively review your choices every year during that fall enrollment period to make absolutely sure your Medicare coverage continues to be the best possible fit for you.